Welcome back. So although the number of Americans newly diagnosed with diabetes has fallen, the overall total number of cases continues to rise. There are important lifestyle choices we can make that may prevent additional cases. Here to tell us more, welcome Katie Lauro with Tri-City Wellness Center. Good morning, Katie.
Good morning.
Okay, you're a registered dietitian, and we want to talk to you a little bit about why this topic of diabetes is so important.
Well, in 2014, we now know that there are 22 million people that are diagnosed with diabetes, which is a very large number, of course. There are 86 million people that are pre-diabetic and undiagnosed, and 8 million that are undiagnosed. So that's about 30% of our population. So that's epidemic proportions.
Go ahead.
Oh, so it's really important to understand your personal health status, because diabetes can be such a dangerous disease.
And so when you say understanding your disease, there are a lot of lifestyle choices that go with this disease, and in many cases you can control this disease with making healthier lifestyle choices. So tell us what some of those are.
Absolutely. So it's really important to get daily activity. That doesn't mean you have to be pumping iron in a gym. It doesn't mean you have to be a runner, but just moving for at least 30 minutes every day. Understanding your portion sizes, understanding labels, so looking at how much sugar is in something that you're eating, balanced meals, high fiber, lean proteins, getting enough of vegetables. If you can make half your plate vegetables at every meal, I mean, you should be in a good state there. And also going to the doctor and understanding what your blood values are. What is your fasting glucose? There's something called your A1C, which will give you a snapshot of how your blood sugar has been in the past few months.
So it kind of gives you a base level, and you're able to see how much variation there is in future months.
It'll tell you how you've been managing it. Is the best way to describe it.
And managing it is so important here, because all of our systems are interconnected, and this is really important when we're talking about diabetes. Tell me why.
Absolutely. So diabetes is still the leading 7 causes of death, because it leads to high cholesterol, risk of heart disease, stroke, kidney disease. It can also lead to blindness, amputations of limbs, so it can get very serious when people aren't managing it. So even if you have the disease, practicing healthy lifestyle choices can manage the disease, and it can also manage the amount of medication that you're taking in.
Very important.
Yeah, and it's not a good practice to say, well, I'm managing it with medication. You need to manage it with your lifestyle overall.
Okay, well, with so many diseases, you know, you cannot make lifestyle choices that would necessarily affect it so dramatically. So at least that is the good news, that you can somewhat get this under control, and in many cases really control it in a healthy way.
Absolutely. So I recommend that anyone that has prediabetes or diabetes to go, or a history of diabetes in their family, to go see a practitioner and understand the disease, understand the risk factors, and understand how to eat appropriately to manage it.
Such important tips. Katie, thank you so much, and we'll have you back tonight at 10 p.m.
Thank you.